Gastrointestinal cancers are diseases that can be successfully treated with early diagnosis. At Memorial, our specialists combine science and innovation to design a personalized treatment journey for every patient.
Hello, I'm Dr. Leyla Özer, professor in medical oncology. I'm working in Bahçelievler Memorial Hospital. Today we are going to be giving a short information about gastrointestinal system cancers. What we mean with gastrointestinal system cancers? That means the tumors starting from esophagus, this is the digestive tube, stomach, small intestine, large intestine, or we call it as bowel, and rectum, which is the distal part of large intestines. And also, although rare, anal cancers are also included in the gastrointestinal system cancers. Apart from these, as we know that there are also pancreatic and hepatobiliary cancers, which means that tumors that are originating from the liver. Of course, every type of cancer has its own symptoms, but we have to be cautious about these signs and symptoms, and we have to define these in order to diagnose the diseases in the early period. So, depending on where the tumor originates, the symptoms can differ. For example, for stomach tumors, we know that patients may complain about some dyspeptic symptoms, what means like kind of discomfort or pain either before or after meals. But there are some alarming symptoms for different types of cancers, but mainly we can say that loss of body weight and blood in the stool and change in the bowel habits are important symptoms that should alarm us and make us go to the doctor. I would like to give a slight more detailed information about the colorectal cancers, especially about the symptoms. What kind of symptoms should alarm us? Well, we know that especially the change in bowel habits is quite important. What does that mean? A new period of long period of diarrhea, a new period of constipation, a difference in the caliber or the diameter of the stool. These are very important signs. Of course, depending on where the tumor originates, the symptoms can differ. For example, for left-sided colon tumors, we know that the change in bowel habits is important, but for right-sided tumors, these symptoms can be not that much as definite, and the patient may arrive just kind of weakness, sometimes loss in body weight, but also anemia, which means insensible loss of blood in the stool, and so we can end up with the symptoms of anemia, such as palpitations or weakness, and these may alarm us, the doctors, in order to go through with a colonoscopy and an upper GI endoscopy. There are some different risk factors for colorectal cancers. We can divide them into two. There are some hereditary disorders and also some environmental causes that may provoke colorectal cancers. For hereditary syndromes such as Lynch syndrome, we know that it is an important familial genetic disorder that is inherited and does not only cause colorectal cancer, but also it may increase the risk of endometrial cancer, gastric cancer, and also urothelial cancer. But there are also some environmental factors. What are these environmental factors? We know that smoking, eating habits such as consuming too much processed food, consuming too much sugar may cause an increase in the colorectal cancers. Also, less exercise is another risk factor for increasing the colorectal cancer occurrence. The treatment modalities in colorectal cancers available these days depends on in which stage your disease is diagnosed. If this is an early disease, surgery may end up with total cure. But for some patients, we may need some additional therapies after surgery, such as chemotherapy. We call these kind of therapies as adjuvant chemotherapies, which decrease the risk of further recurrence of the disease. The colorectal cancer can also be diagnosed in a more advanced setting. When the disease goes out of the colorectum and to the liver, to the lung, or elsewhere. In these cases, we start with some systemic therapies, which may include chemotherapy, targeted therapy, and immunotherapy. And even if you have a metastatic disease, after appropriate, personalized treatment that will be defined according to your molecular characteristics of the tumor, you may still undergo a curative surgical resection or other interventional procedures that may still end up with cure.